Lens replacement surgery is exactly like cataract surgery. What you do is you replace the natural lens, which is focusing on the wrong part of the retina, and replace it with a lens which is bespoke for your eye and allows that to be corrected, so you could be spectacle free. It is one of the safest surgery that an eye surgeon would perform. As I said, it is exactly the same as cataract surgery. The risk of having any problems is 1 in 1,000. That's almost the same as you getting hit by a car, the risk of you getting hit by a car when you're crossing the road. So the risk is minimal, and it's the commonest operation that we would perform as an eye surgeon. So it is a very, very safe surgery. First of all, we need to decide whether you're suitable or not. So you go through various diagnostic and clinical tests with the technicians, the optometrists, and myself to discuss what's the best lens for you. On the day of the surgery, you have drops to dilate your pupil and anesthetic drops to numb the eye. The procedure almost takes only 20 minutes. You're lying down flat for about 20 minutes. You have a little clip to keep your eyes open and a bright light which you're focusing on. You feel push and pull during surgery, no pain at all. And what you do hear on the background is you hear this ultrasound machine which replaces or aspirates the natural lens, and we gently replace it with the artificial lens implant. When you're coming back from theatre to the ward, you'll be coming back with a shield on the eye, and it takes about 24 hours before you'll start seeing the difference. It takes typically a week for the eyes to heal. Anyone who's aged over 40 years or older is suitable for lens replacement surgery. It is suitable for anyone who's short-sighted or long-sighted. If you're astigmatic or presbyo, it's suitable for everyone. This is the best solution that's available to get spectacle-free, whether it's for distance or near or for both. Lens replacement surgery almost ensures that you will never get cataract for the rest of your life. So it is kind of almost 2-in-1, where you do have lens replacement surgery, so you'll never need cataract in the future.